Hello all, welcome to the lesson on teratogens. Teratogen refers to any environmental agent that causes damage during the prenatal period. The effect of teratogen depends on the dose, heredity, other negative influences, and age. These are some of the different types of teratogens. We have already discussed the medicated and non-medicated drugs and incompatible blood types. The others are maternal diseases, maternal age, paternal factors, environmental hazards, and prenatal care. In maternal diseases, it's divided into three. One is a virus, bacteria, and parasite. Under the viral maternal diseases comes acquired immunodeficiency syndrome, chickenpox, cytomegalovirus, herpes simplex 2, mumps, and rubella. In bacteria, chlamydia, syphilis, tuberculosis, and in parasite, malaria and toxoplasmosis. We'll look at some of the major diseases here, starting with the virus. In virus, the most common disease found was rubella. So, in the mid 1960s, a worldwide epidemic of rubella led to the birth of more than 20,000 American babies with serious defects and to 13,000 fetal and newborn deaths. So, it was found that if the mother contacted rubella during the sensitive period, that is the embryonic period, it meant that almost 50% of the infants were born with deafness, eye deformities, heart, genital, urinary, intestinal, bone, and dental defect. It also caused intellectual disability in the child born. If the mother contacted rubella during fetal period, it led to low birth weight, hearing loss, and bone defects in the infant. The second most common viral infection was AIDS, caused by human immunodeficiency virus. If the mother was infected with HIV, she passed on the virus to the infants almost 20 to 30% of the times. The infants, once the HIV virus is born in them, it progressed rapidly, and by sixth month after birth, they start showing symptoms like weight loss, diarrhea, and respiratory illness. It also causes brain damage, leading to seizure and delayed mental and motor development. Nearly half of the infants die by the age of 2. The remaining ones, out of them, almost 90% of them die within 2 years of age. The only prevention is antiretroviral drug. So this is a vaccine which is given to the mother during the pregnancy time. If the mother who has an HIV or AIDS takes this vaccine, 95% of the time the child will be safe from the virus. The next two important viruses are cytomegalovirus and herpes simplex 2. Both are prevalent in mothers who keep a monogamous relationship or multiple partners. So, if the mother contact any of these viruses and pass on these viruses to the children or the infants, there is chances of miscarriage, low birth weight and prematurity, physical malformations and intellectual disability. The main trouble or problem for this particular viruses are that they shows little to no symptom, so it makes very difficult to diagnose these viruses in the child. The next one is parasitic disease. A most commonly found parasitic disease is toxoplasmosis. It is caused by a parasite found in many animals. So, pregnant women may become infected from eating raw or undercooked meat, or there is also a chance that they may contact it if they come in contact with animal feces. So, if the mother contact this virus during the first trimester, it is likely to cause eye and brain damage to the developing fetus or the zygote. Later, infection is linked to mild visual and cognitive impairments. There is also a chance that the child will be born with learning and visual disabilities in later life. The next teratogen we'll be discussing is maternal age. Over the past 30 years, first birth to women in 30s have increased fourfold, and those to women in early 40s have doubled. Many couples are putting off childbearing until their careers are well established and they know that they can support a child. These women who delay pregnancy face their own share of risk like infertility, miscarriage, and chromosomal defects in the child. But study shows that women in their 20s and 30s share equal reproductive health. The only difference is individual health and living circumstances. But the studies have also shown that age group of 50 to 55 in women where menopause begins and reproductive organs age is high risk category. Women belonging to this age group are highly prone to infertility, miscarriage, and other birth complications and defects. Moving on to the next factor, which is paternal factors. So, men's exposure to lead, radiation, and certain petrochemicals may cause abnormalities in sperm that leads to miscarriage and childhood cancer. Some of the other paternal factors are vitamin C deficiency in males. So, if the father has vitamin C deficiency, it can cause birth defects and cancer in the child. If a father consumes cocaine during or before the conception, it can result in low sperm count, low motility of sperms, and higher amount of abnormally formed sperm, which will further lead to chromosomal defects in child. If a father smokes during the pregnancy term of the mother, it can result in low birth weight and chances of cancer in the child. The father's age is also a determinant for the child's health. If a father ages more, considering like 50 to 55, 50 to 60 age group, one thing the person cannot naturally conceive the child. The next is birth defects like dwarfism and Down syndrome can be prevalent in the child. Moving on to environmental hazards, starting with mercury. So, an exposure to mercury during the pregnancy time that can lead to physical deformities, intellectual disability, abnormal speech, difficulty in chewing and swallowing, and uncoordinated movements. The next is polychlorinated biphenyls. These are usually used as insulators for wires. So these chemicals get in touch with water, and it can also its exposure can also lead to low birth weight, discolored skin, deformities of the gum and nails, delayed cognitive development, persisting attention and memory difficulties, and lower intelligence score in childhood. The next is lead. Lead is also present very much in the environment, and an exposure or overexposure to lead can lead to prematurity, low birth weight, brain damage, poor mental and motor development, and wide variety of physical defects. Dioxins are toxic compounds resulting from incineration when we try to burn a waste or sanitary napkins. So this is linked to brain, immune system and thyroid damage and an increased risk of breast and uterine cancer. It also impairs fertility of males. The last one in environmental hazards is radiation. So radiation, as you'll know, there was instances of radiation in Hiroshima, Nagasaki, always also during the Chernobyl nuclear power plant explosion. So, from the studies conducted there, it was found that an exposure towards radiation can cause underdevelopment brain and physical deformities, slow physical growth, miscarriage, and childhood cancer. It can also result in lower intelligence test score in children. It is also advisable that the mother refrain from going for an X-ray, any kind of X-ray during the pregnancy, and if at all it is very necessary, the abdominal part should be covered properly. So these are the environmental hazards that leads to childhood deformities. Moving on to the last, which is prenatal care. So while a mother should be taking care of herself, her health, her nutrition, and etc., there are something else which is also very important. First being scheduled visits for medical care. Only if the mother is taking proper guidance from the doctor or a midwife, only then can her pregnancy be smooth. The doctor will take care of many aspects, see if the child has any deformities from birth, will check the diabetic level, hemoglobin level, and keep account of all the factors that are necessary for the mother as well as the child. If due to poverty or underdevelopment of the country, a mother fails to have a scheduled visit for medical care, there is an increased risk for the child. The second factor is social and nutritional services. So, a mother should have adequate social support to help her emotionally and psychologically cope with the pregnancy and childbirth. Nutrition is also very important during the time of pregnancy as well as post delivery because the mother will be feeding the child. Nutrition helps in the growth and development of the child. It also helps to keep the mother healthy. The next factor is exercise. So it said that the research have shown that certain amount of exercise has always been found very good for the child as well as the mother. The child showed increased brain development and motor activity, and the exercise also helped mother in easy recovery. The next factor or the last factor is pregnancy and prenatal education. So, a mother who is very new to pregnancy will face so many difficulties, will have so many questions, and there is high chance that she may do some wrong, may not do everything in the right way. So, only pregnancy and prenatal education can help her deal with all her issues as well as take care of her health properly. So, we have come to an end of our lesson. Thank you so much.